Good to talk to you again, Peter. Regarding the pandemic that's sweeping the country and the globe, you've spoken out against the measures that the government are taking as being very dangerous and not necessarily proven to work. And what it seems to me to be is that we've got a balance between short-term and long-term consequences. My immediate concern, our immediate concern, is for our health and the health of our loved ones. But the point you're making is that the long-term consequences of this lockdown are going to be far worse than the short-term supposed effects.
No, that's not at all my point. I mean, that is obviously also the case. But my point is fundamentally that the response is ill-researched, scientifically questionable, and wholly disproportionate to the problem. And thousands of people die every year in Britain because of cigarette smoking. But a government which is prepared to put the entire population under house arrest is apparently not prepared to make the sale of cigarettes illegal, for example. But then again, on the science, so the Imperial College team, whose prophecies of hecatombs of death are being accepted as if they were a vision of the future that couldn't conceivably be challenged, can be challenged. And I don't, having looked at their paper, see that there's any necessary reason to assume that they're right. And there are many, many experts who do not think that they are. There is also the simple fact that we neglect. I don't have the figures in front of me here. I published them not above 1,000 times on my blog and on Twitter, which I got from the government about annual deaths from influenza and its complications. They're far higher than anything we're experiencing at the moment from coronavirus. And then you add to that the fact that people are being listed as dying with coronavirus, which is technically correct. What this does not necessarily mean at all is that they've died of it. And the people the most common example of this known to many people is, of course, the many men who die with prostate cancer, but who've been killed by something else. My late father died beyond doubt of cancer of the esophagus, but he was actually listed as having died from a heart attack, which is technically true. He had heart failure brought on by the cancer of the esophagus. And you have to be very careful with how you attribute these things. In Britain at the moment, and this is normal, 1,600 people die every day because they are old and because they are old and ill. And this is what happens. We all suffer from a fatal disease called life, which will come to an end with death. And the question that might reasonably asked at the moment is whether the actual death rate is rising or whether people are attributing to coronavirus deaths which might well have happened anyway. So the whole basis on which we've been subjected to this seems to me to be questionable. If you've grown up and lived your life as I have in close contact with the political classes of this country, you do not automatically assume that their judgments are good. In fact, rather to the contrary, and I don't see any sign at all that these people have considered this. They've jumped to a conclusion and pursued it. My favorite metaphor of this is a man gets pneumonia, who goes to the doctor, who has no real idea what to do, but proposes to amputate his leg. The man eventually recovers from pneumonia, but only has one leg, and the doctor then says that he cured him. And that's basically what's going on. An illogical, ill-considered response to a problem which might well not be anything like as serious as claimed, and a disaster. I mean, the early part of this, before the government went completely off its head, I did point out that the economic consequences of it were absurd, but I also warned of the civil liberty consequences of it, which were contained in the coronavirus bill, rammed disgracefully through the Commons without a vote on Monday. What I didn't realize was how quickly the government would reach for the tools of repression and social control to try and control the disease. You only get all kinds of evidence. Again, I cite several professors, including one from Mainz in Germany, whose words I've had have been translated and I've had transcribed onto my blog. He's an expert in this matter of great experience and wisdom, and he says the whole thing is crazy. And he's not alone. And you get that Professor Ioannidis of Stanford University, United States. He says the figures being bandied about of death rates for coronavirus is statistical absurdities. It simply isn't true what people are saying. And then again, you look at places like Japan, where they have not adopted these methods and where the disease is not spreading particularly. And people keep telling me that it's testing and isolation which have kept it down in South Korea. But actually, I don't think that's true. It simply did not spread to the extent in South Korea that it did in China. There are all kinds of other aspects. We're constantly told about Italy, but never, as I say, about Japan or about Iceland or about Latin America, where things are wholly different and where these methods which we're using aren't being used. And so the assumption is being peddled that if we all do stay at home, losing our minds and losing our health for the next 6 weeks or 6 months or however long it is that this madness continues, and when the disease goes away, that it will go away because we've all stayed at home. I don't think this is true. There's a very interesting paper from Oxford University published in the Financial Times, I think yesterday, which says that it seems quite likely that a very large number of people have already had coronavirus, in which case they're probably immune to it. There just isn't, because the British media and the British political classes have been so supine and incurious about this and have accepted exactly what they've been told by this teenage government. We're entirely without a serious debate on the matter. Almost everything I've said to you will be wholly unknown to 99% of the citizens of this country because of the complete dereliction of most of the media in discussing the matter. It's shocking to me.
Often with mainstream and government assertions, think of the case of Duma last year, where you had that interview with Andrew Neil where you were lambasted for your comments, and then you were proven, you were vindicated.
Well, yes, I was, but here's the curious thing. I had an interview with Andrew Neil. I was permitted to make a film for that program in which I put my case. I was able to discuss it. And when I had been on Andrew Neil's program, a very large number of people who previously had been unaware there was any controversy about this were apprised of that and thought that I had been unfairly treated. The thing was, I got on. In this case, apart from my own newspaper, The Mail on Sunday, which behaved with extreme goodness on this matter, and the one radio station, Talk Radio in London, which has interviewed me about this, you would not know that anybody was raising any of these things. And the thing is, it's not just me. I am quoting as I raise them, as I say, distinguished academics who actually dissent from what is being done. Yeah. But you would not know that there was any dissent. This is the silencing. It's quite shocking. And nobody, if you aren't even aware that your world is being censored, then you carry on as if this is obviously the absolute truth. Yeah. So I must say, I do wonder what's happened to the people of this country that they are so willing to accept on trust what government says, and especially governments headed by people such as Alexander Johnson, who has neither a reputation for responsibility nor one for accuracy.
Which is true. But it's not just the government and the media, is it? It's also the NHS staff and the ICU doctors who are pleading with the people.
Well, we don't know. I've never seen an NHS ICU doctor questioned. You get people who say that they are NHS doctors, and they're given long periods on radio stations talking about how terrible it is in A&E. And I don't doubt that it's terrible in A&E. The whole point, and in ICUs, the whole point about ICUs is they treat people who are grievously ill, and often in pretty horrible circumstances. Normally, the government and the NHS do not permit reports from these places. But I can absolutely guarantee to you that if someone said to these doctors, well, hang on a minute, what about 2 or 3 years ago, whatever it was, when 28,000 people died of flu, wasn't it pretty tough in the ICU then? What are you comparing this with? And then the reports from Italy, again, it's almost never mentioned, except very much in passing. But I think more than 90% of the dead in Italy are actually very old people, and almost 99% are suffering from what are called underlying conditions. Underlying conditions usually means very bad heart conditions or very bad respiratory conditions or other circumstances which mean that they were probably pretty close to death in the first place. And the other thing which is often pointed out about Italy by people who are in this argument is that northern Italy is one of the most polluted parts of the world, and anybody living there has already probably suffered quite considerable damage to their respiratory systems from the very high levels of pollution. So that could also explain the high level. But again, it's just not examined. Nobody reports it like proper reporters saying, well, this is said and now somebody says this. It's all, this has happened, it's terrible, we must act.
Yeah.
And this is how we must act. The logical thing to do is to confine everybody to their homes.
Yeah. A lot of it is just looking
which for many people, particularly the healthy old, is catastrophe, because all their social activities which have kept them happy and contented stop. And all the exercise which they've taken, which keeps them healthy, stops. And the whole world comes to them. Huge amounts of people are going to be suffering from clinical depression as a result of this.
Yeah,
in my view.
Not just old people, but young people too, who are isolated and lonely.
Well, about them too. But I mean, I am constantly, whenever I raise it, people say, "Oh, well, you don't care about the old. You want them all to die, to sacrifice them for others." Absolutely not. I'm old myself. I'm 68 and getting older every second. But I just don't think this is a wise policy. And frankly, if I died next week from it, I still wouldn't think it was a wise policy.
The concern that's been put forward is not necessarily first and foremost the total amount of deaths that occur, but
but it is the whole modelling. The modelling of the imperial report suggests that huge numbers of deaths are going to follow if we don't do this.
Yeah, but it's the concentration.
This is crucial to the argument of the shutdown.
You've got the flattening of the curve, which is argued, rather than having it spread across, rather than having.
Well, that too, but the problem with the flattening of the curve, of course, is it means it extends the period during which A&E comes under pressure. It has a disadvantage as well as an advantage, but always assuming, as I say, that this can work. The Oxford report suggests that my suspicions are right. My suspicion is that this disease has been abroad in this country quite possibly since December. You can have it, and this is another thing. The media say so-and-so number of people have been infected by it, as if this was a terrible thing. You can have it without even knowing. It is often asymptomatic. And when you do have it, it is often, again, it has symptoms which, though they're unpleasant, and by comparison with a lot of things, mild, let us say they won't kill you. And so it's perfectly possible to have it without being carried off and tipped into a mass grave. But you get the impression from the coverage that infection was the thing to dread. And in most people's cases, it simply isn't true. And in many people's cases, they probably already had it and are immune from it, and also can't spread it. But because the government doesn't do much in the way of testing, you couldn't really establish that. It would be very difficult to have mass testing, extremely expensive and time-consuming. But I think that there might be some thought about doing some samples to see how it's going. But I say the Oxford report that the FT carried is fascinating in this. If it turns out to be right, then it suggests that our policy is misguided. Again, like so many of the other serious scientific considerations of it.
I did see a Guardian article just in the past few minutes saying that the Amazon are hoping to be shipping large numbers of home testing kits in the next few days.
Well, I don't know. I'm not sure that the testing could be done at home, but who knows? I've got no idea. It would seem to me that testing of this kind would necessarily involve professionals who would probably at the moment in most cases be better off treating patients. But I don't know. I can't say.
How do you think this compares to the 2009-2010 swine flu epidemic?
I can't remember, I'm afraid, very many details of it. There's been so many of these alleged epidemics and pandemics over the past few years. I published in my Sunday article a list of them, which Simon Jenkins compiled. Most of them didn't amount to anything very much.
No, they didn't.
I mean, obviously, it's bad when people get infected with respiratory diseases, but these things are not on this kind of enormous tidal wave scale that's being suggested.
I found an article on the Conversation website comparing the two pandemics 3 or 4 months into the swine flu epidemic, which is where we are now with COVID-19. I mean, this is the World Health Organization's statistics. 429 global deaths 4 months into the swine flu epidemic, as opposed to 14,000 deaths globally for 4 months into this one, which is a stark contrast.
Well, it may be, but I don't. Again, this attribution of death is a very complicated thing.
Especially short term, as you say, because we're so in the thick of it that it will take a year or two of looking back on what exactly were the causes of death to give a calm and measured response. So I do.
Nobody will ever find out.
No, that's true.
I doubt. Hello.
Hello.
Nobody will ever find out. I doubt very much whether we'll ever know. It will be possible for anybody to discover.
I think that surely. I mean, if as you say, there were people who had COVID-19 maybe in December, in the country, there must, I mean, as there are cases now of severe cases, ICU beds being used, wouldn't there be somebody who would come forward and say, I had this in December and it was serious, compared to the amount of cases that are now causing ICU
Well,
hospitalization?
why would they? I mean, you have it, people. Lots of people have flu-like diseases, and they go to bed and they take some paracetamol, some hot lemon and honey, and they sweat it out, and then they go back to work, and that's it. They know better than to call the doctor, because the doctor isn't generally going to do much for them. Huge amounts of diseases of that kind are not recorded. There wouldn't be.
What do you make of the young and healthy people on ICU or who have died? I mean, I've got a 35-year-old friend of a friend in London with no underlying health conditions who is currently having severe breathing difficulties. A 28-year-old healthy man.
Well, I don't know, because I'm not a doctor. I don't know anything about the case. I can't conceivably make any make any determination about somebody I've never met, know nothing of, and haven't seen medical reports on.
No.
I no doubt it's been possible for a healthy teenager to die as a result of complications from COVID-19, just as it's possible for people to die from complications of all kinds of diseases that don't generally hurt people very much. But whether you can make a rule out of that which requires you to shut down the entire country and wreck its economy, I'm not sure.
Quite. It's the
my own general feeling would be probably not.
No, it's crossing that line into a dystopia. That is the issue, isn't it?
No, it isn't. I think there's a point here. Which, if you say that somebody who's got serious heart disease or serious lung disease or both dies, and they have the coronavirus, I think it's actually misleadingly wrong if they've died of the coronavirus.
Right. Hello, you still there?
You know, you have some 70s or 80s who are seriously ill and they die, then I think one could say that they've died because they're ill and because of old age.
Yeah, it's possible. It is true. It's one of those things that, because we're in the thick of it, it's so hard to actually make any decisions that aren't driven by panic and by looking at what's happening in other countries. Did you see the Libertarian Tory MP Steve Baker speaking in Parliament a few days ago, close to tears almost, as he was approving?
Well, I did, but I wasn't terribly impressed because he seemed to have accepted by and large the government's argument.
Right. And he was obviously very moved by what was happening and the fact that...
Well, the different ways it moved. I showed that I moved by going off and doing some research. I think it's the best way of doing it. I mean, it's all very well to be unhappy in public, and I'm sure it's very distressing for it. It's very distressing for us. It's more distressing for me that he didn't vote against the bill. As far as I'm concerned, there is not a single member of Parliament who should ever be returned to Parliament. There was a complete dereliction of duty on Monday, and none of them is fit to serve in Parliament. The thing was not properly considered and should never have been passed.
Do you, looking at the issues...
For it to have been passed without a vote is so shocking that it almost beggars belief.
That is shocking and a massive...
That's me being emotional.
One sign of showing it. What do you make of Italy and France and Spain's situation with their lockdowns? Do you think they're justified or warranted?
Well, I think in the countries which are used to autocracy and despotism, they always have been, and it's a tool they reach for. And they've long for opportunity to do so, but it doesn't necessarily mean we should follow their example. We used to be quite proud in this country of not suffering from this problem, but we seem to be only too anxious to emulate them. My own guess is that what is quite likely to happen, and I have to be careful how I say this because I don't want to be accused of in any way inciting it, but it's quite possible that what we're doing now will not work for a certain part of the population. And as a result, the government will visit collective punishment on the rest of us who have been more or less following the rules, and we will be told that we can't leave our houses for more than 10 minutes a day and forced to get to fill in forms to do so, and all the sort of things that are happening in France now. I think it will get worse. And I also think it's quite likely that it will lead to restrictions on freedom of speech in the press as well, because having chosen this direction, as long as the policy fails completely to eradicate the disease, the only thing it can do is become more and more repressive. So how much longer you and I will be able to have a conversation of this kind, and how much longer anybody will be able to publish the things that I say, I wouldn't like to say with any confidence. And if you laugh at this, then I have to say to you, 2 weeks ago, could you imagine the entire country would be under house arrest?
No. Very true.
No, it's the direction of this is so wrong, and the nature of the response is so dangerous that it has no limit.
It sets a dangerous precedent of what can come. Though they say that it is temporary and that in 6 months' time they'll review it. But
I think the Official Secrets Act was temporary, still there.
Yeah. Regarding social distancing and staying at home, where do you put or consider things to be reasonable in terms of?
I think it's largely nonsensical because, as I say, I think the already probably done most of the spreading it's going to do, but because everybody else thinks it's wise, I follow it. And if I go down to the supermarket, I even wrap my head in a scarf like Zorro. So that I don't breathe on them. If people genuinely think it's going to work, then I will keep 7 feet away from anybody when I'm on the street. All of it, I do all of it, because why not? I mean, it's only politeness to people who are frightened, but I don't frankly think it will have very much effect. I think the disease has been in this country for months. It's been spreading for months, and actually quite possibly the change in the weather which we're now experiencing may seriously weaken it. I'm told that viruses are generally unhappy with bright sunlight and warm weather. Certainly in Latin America, it hasn't made much progress.
Well, time will tell. Time will tell what the...
Well, it will, but the problem is it will be like my parable about the doctor and the pneumonia and the amputated leg. Whatever happens, when the disease goes away, the government will say it was its action which achieved this.
Yeah.
And there won't be any elaborate report or inquiry to discover whether it was. When we get another of these, there'll be another of these. There's no end to it now. I mean, this is one of those weeks when, quite frankly, I'm quite glad that I won't be living all that much. But if people used to ask me, they used to say, what should I do? What should I do about this country? You say it's so terrible and pessimist. Well, get out. Leave. And they say, they'd laugh, thinking I was joking, which I absolutely wasn't. And look at this. This is the sort of thing I couldn't have predicted. I couldn't predict the detail of the decline and misery and repression which I believe is coming to us. Because you can't. It always comes in unexpected forms. But in general, this does not surprise me. And nor does the supine flaccidity of the population in the face of being bossed around in this fashion.
Well, thank you for your time anyway. It's food for thought.
Okay, all right.
I do dread to think where things are going. I hope that...
it's terrible, but this is, I'm afraid, the nature of human civilizations. They destroy themselves. They get so comfortable they think they are not in danger, and so they ignore the dangers when they present themselves.
I mean, I hope you're right about the virus.
And here we are. Here we are again. Anyway, I have to get back on my way.
That's fine. Thank you for your time. Take care. Bye-bye.
Thanks a lot. Bye-bye.